Folks, how are you? Welcome to another edition of LPTV. My name is Michael Lynch. I'll be your host today, and our subject will be Stevens-Johnson syndrome. Stevens-Johnson syndrome is an inflammatory skin condition. I do want to alert our viewers some of the graphic images may disturb you, which are shown on today's show. My guest today is Ms. Lee Morris-Turtle, who's going to tell us more about Stevens-Johnson syndrome. Lee, can you tell our folks what is Stevens-Johnson syndrome?
Sure. Stevens-Johnson syndrome is also referred to as SJS. And it's a serious disorder affecting the mucous membranes. It's thought to be an allergic reaction to certain medications. And essentially what happens is, and there's no other way to really describe this, during this allergic reaction is the patient's body actually burns from the inside out.
Lee, if you could tell us what type of reactions can one expect with Stevens-Johnson syndrome and what parts of the bodies are affected?
Well, not only is the skin affected, clearly you see burns that look like as if someone was burnt in a fire. Your organs, your esophagus, every part of your body, specifically your eyes. If this isn't caught early, it can cause permanent blindness. It can cause inverted eyelashes and major ocular problems.
Now, regular viewers of this show have known, I've quoted this statistic before, adverse drug reactions is the fourth leading cause of death in the United States. Lee, what class of drugs or classes of drugs cause Stevens-Johnson syndrome?
There are three main classes of drugs that cause SJS. There are NSAIDs, which are non-steroidal anti-inflammatory drugs. These are your Aleve, your Tylenol, typical drugs like that. Secondly is sulfa-based drugs, antibiotic drugs like Bactrim. And thirdly, COX-2 inhibitors, and there's been a lot in the news about COX-2 inhibitors, Vioxx, Bextra, Celebrex, those types of drugs.
Now, folks, many people are aware of the problems associated with Vioxx, Bextra, and Celebrex, those COX-2 inhibitors which you recently mentioned. Most of the concern has been regarding its cardiac implications, the abilities of those drugs to cause increased risk of stroke and heart attacks. But what we're hearing right now is that these drugs also can cause Stevens-Johnson syndrome. Now, particularly with Bextra, what is it about Bextra that causes it to have such a predisposition to causing this condition in people?
Well, Bextra is what we would call a triple threat. Not only is it an NSAID drug, but it's a COX-2 inhibitor and it's a sulfa-based drug. So it's a lethal cocktail. It's basically a prescription for SJS.
Now, how is it diagnosed?
Normally what you see is a person starts a new medication. Within 1 to 3 weeks of starting the new medication, they have typical cold and flu symptoms, a cough, a sore throat, a fever. And then very, very shortly after that, between 1 and 3 days after these very common symptoms, they'll start experiencing rashes, burning sensation in the skin, in the eyes. Normally they're presented to an emergency room. Hopefully the doctor asks right away, have you started any new medications? If this is the case and it's caught early, then with the correct treatment, patients will be fine. But if this is not caught early enough, it can be just catastrophic.
Well, as you can see, folks, the images of this condition are truly horrific. Now, how did a drug or a class of drugs that can cause such a disabling condition essentially fly under the radar of the FDA?
Well, what we've seen in this case is that physicians, and in many, many cases, physicians and manufacturers are just failing to warn patients of possible interactions between drugs they're prescribing and drugs that patients are currently on. Furthermore, it seems like SJS could result from a genetic predisposition. So if patients were warned of an allergy to a sulfa-based drug could cause this condition, you would see less and less of this happening.
Lee, I want to thank you for coming on today and telling our viewers about this. Folks, I want to end my show as I often do by encouraging people to be their own patient advocate. Do not rely upon pharmaceutical companies and even your doctors to be able to tell you all that might be wrong with a particular medication, all the adverse events that one might experience. Do your own research, be your own patient advocate. Lee, I want to thank you again for coming on today.
Thanks for having me.